I'm Dr. Nicholas Perraudot, and I'm Assistant Professor at the University of Toronto in the Department of Obstetrics and Gynecology. Now, my first delivery was over 50 years ago with Sister Savage at King's College, and after a 36 hours harrowing experience of pregnancy and labour and delivery, we delivered a lovely, healthy boy, and that really got me going. In my career as a practicing obstetrician, I probably delivered about 20,000 deliveries in total. Well, it was just like that first delivery all those years ago. The excitement and the creation of a baby who comes alive, is crying, and has a whole life ahead of him, and exciting things, that to me was one of the most exciting experiences I'd had up to that time, and it got me hooked on doing obstetrics. I said to myself I would quit being involved in obstetrics when that feeling disappeared, and it's not disappeared yet. Well, I think we have to be aware that there's one person and there's another person coming along. So we actually have two issues. One, the mother, and of course the death of the mother is absolutely tragic. It's not only because we've lost somebody, of the mother, the tragedy of either a maternal death or a severe complication, or a baby dying, or a baby being born in not optimum circumstances is absolutely awful. I would only use the word maybe terrible. As we know that approximately 60 to 70% of stillbirths, we can't give an answer to why we lost the baby.
I'm Louise OBrien. I'm an associate professor at the University of Michigan. I'm in the Division of Sleep Medicine. So I do a lot of research with sleep and pregnant women and how sleep disruption impacts both the mom's health and the health of the baby. I got into this area because a long time ago, when I was a graduate student, I was doing research into sudden infant death syndrome and why babies, die at night. And so I was monitoring a lot of babies at night, and I realized then that I really didn't know much about sleep. What's happening when we sleep. So that got me really intrigued, and I decided that I needed to learn about sleep. And that's how I ended up getting into sleep research and realized that I really miss being with the moms and babies. So I think typically when we think about risk factors for adverse pregnancy outcomes, we think about maternal age, we think about obesity, we think about smoking. All of those things are either impossible or very difficult to change during the course of pregnancy. And what we've learned over the last decade or so is that how we sleep has an impact. And we actually have an opportunity to change it during pregnancy, which ultimately could result in improved pregnancy outcomes. And that's the whole goal of what we do. We can change it while you're pregnant. We can't change your age, but we can change how you sleep. And ultimately the goal is to get a better outcome. In terms of sleep position in pregnancy, there was a study that came out from New Zealand that was the first study that showed that sleep position had a potential role in late-term stillbirth, or stillbirth after 28 weeks gestation. And we've been pushing forward on this work. We've been thinking about how we can do interventions for position. So is it a device that we can use? So we've been working with groups to try and figure out how we can best keep women off their back during the night, especially when they're in the later stages of pregnancy, which seems to be the point at which is the highest risk for the baby. Dr. Kemmer had been very excited, and we've kind of worked together off and on. And I actually put him in touch with Dr. Coleman in Ghana, and he went over there, and over the course of several years has developed this PrenaBelt, which is a positional intervention for pregnancy to try and keep women off their backs or off the supine position. So I think it's very exciting to show that potentially an intervention to keep women off their back at night appears to be working. I mean, we've got a long way to go still, but certainly the results are pointing in an encouraging direction.
My name is Jane Warland. I wear many hats. Who am I? I'm a parent to 4 adult children, a wife of 40 plus years, a mother of a stillborn baby, a midwife, a researcher, an author. My interest in stillbirth started with the stillbirth of our daughter in 1993. I think clinicians have always known that when women sleep on their back in late pregnancy, that's not a good thing for the baby. Certainly, from my experience in labour ward, it is just something that you get to do when you see a baby who's showing signs of distress. The first thing you do is move the mother's position, and often that makes a big difference to the baby's well-being. So when Thomasina Stacey published her research in 2011, I think there were a lot of us across the world who thought, that makes perfect sense. And her findings were that if women go to sleep on their back in late pregnancy, that they're at increased risk of stillbirth. And the reason why that made perfect sense to me is that not only did it make sense clinically from my clinical knowledge, it also made sense from the biological plausibility point of view of, we know that there is a big vessel that takes blood to the placenta. And if the mother is lying on that and compressing that, it makes sense that then the baby will respond to that compression and lack of blood supply by becoming distressed or ultimately dying.
Pregnancy is a very pleasant experience. Sometimes the pain comes suddenly and unexpectedly. But the closer you get to the final days, the more excited you are to see the baby. You don't get much good sleep or rest at nights. You can't sleep well, and your muscles are constantly cramping, from the ankles and the legs to both sides of the pelvis. What this does is that it fills the gap between your belly and the mattress and helps relieve the pressure on your belly. And this also helps to support the back and waist while sleeping on your side. I use this a lot during the day for naps. Now that I'm in the final months of my pregnancy, especially now that my belly is getting bigger, the PrenaBelt has been extremely helpful to me.
My name is Pal Mohini. I am from India. I was born and brought up there, and I have a bachelor's and master's in biomedical engineering. I've been with the PrenaBelt team for almost a year and a half now, and I have done a bit of everything. So a lot of customers had a lot of trouble sleeping on their side, and they're finding that sleeping on the side is easier said than done. And a lot of the systems out there that are there to help these women are not as helpful to all of them. A lot of them are still experiencing pain, still experiencing discomfort, and really just want to get a good night's of sleep. And through the PrenaBelt, hopefully we can give that to them.
So my name is Heidi Ward. I'm 23 years old, and I'm a registered massage therapist and a mom of 6 weeks. Well, as anyone can guess, pregnancy is one of the most miraculous and crazy things that a woman's body can go through, and as such, there's a ton of changes that go on. And so as your body is growing and developing and you're increasing weight into the front of your body, your center of gravity shifts backwards to compensate for your expanding belly. And as that's happening, you have things are stretching, things are moving, things are loosening, and that causes a lot of pain. So I tried a pregnancy pillow right off the bat. I was really excited too because everybody had said how awesome it was and how it totally changed their sleeping experience through pregnancy. So I was really excited to try it. I got myself one, and I was honestly pretty disappointed. It was not at all like I thought it was gonna be. And as I got more and more pregnant, it only became more of a hindrance to my sleep. I found that as I was wrapped up in this crazy contraption, trying to roll myself out of bed and get out of it, as I go to the bathroom a million times throughout the last trimester of pregnancy, I was basically fully awake by the time I got out of bed. And then coming back into bed, trying to get back in the pillow, it was a nightmare. And I honestly didn't find that it supported my body how I needed to be supported. So I completely abandoned it altogether. So as you get bigger with pregnancy, and you're laying on your side, your belly is kind of hanging down. So that can also kind of pull on your back muscles as well, and it makes it really uncomfortable to sleep. So if you had some sort of a bolster, which the PrenaBelt offers, that would make it a lot more comfortable for sleeping on your side. As a postpartum support belt, I had a C-section at the end for my pregnancy, and it went really well, but obviously everything is completely different once you come out of that for recovery. And I found the PrenaBelt to be extremely helpful in musculoskeletal support post-recovery.
Well, my name is Salim Kendedi. I am a student from Gabon, a small country in Central Africa, and I'm studying in biomedical engineering at the University of Guelph. Well, I've been working on the PrenaBelt team, and I think it's an amazing thing to be part of this, that we're the first doing it on Earth, so this is something amazing, but how it would help people and the impact of it over the years is something that I'm very proud of.